Good morning, everyone. I'll be discussing about the relationship between contrast sensitivity using SPARCs and RNFL thickness in patients of glaucoma. I have no financial disclosures to make. Now, glaucoma is a leading cause of irreversible blindness worldwide, and as we all know, that gold standard for testing visual function and estimating the disease progression in glaucoma still is the visual field test. Now, there is a proven correlation between the different sectors of the retinal nerve fiber layer damage and the visual field. However, decreased contrast sensitivity in glaucoma patients has also been well documented. Now, to overcome the limitations of visual field testing, especially in old uncooperative patients, contrast sensitivity testing, we hypothesize, can be a very useful tool. Now, why SPARCs? Now, Space Enrichment Contrast Sensitivity Test is an online test which can be taken by the patient at home. It measures contrast sensitivity in one central and 4 peripheral areas of vision and has no confounding factors of language and intelligence. Now, the purpose of this study was to determine the correlation between contrast sensitivity and retinal nerve fiber layer thickness in different areas of vision in patients of glaucoma, and also to understand the reliability of SPARCs as an early diagnostic tool in glaucoma, and to understand whether changes in contrast sensitivity can be a potential indicator for the level of glaucoma damage to the retinal nerve fiber layer. It was a prospective observational study. 142 eyes of 91 patients, 18 to 85 years of age, diagnosed as moderate to severe glaucoma at least 1 year prior to joining the study were taken. Any incisional laser eye therapy in the past or any other retinal disorders which can affect the contrast sensitivity were excluded from the. Now, routine anterior and posterior segment examination was done and followed by peripapillary retinal nerve fiber layer thickness measurement using the Cirrus HD OCT. Now, the SPARCs test was done using a computer monitor with 1024x768 display resolution in a dark room. The patient was made to sit 50 centimeters in front of the screen and they were made to fixate on the center. Gray bars will flash in one of the 5 areas, and if seen, the fixation was again resumed and the bars flash in a different area. Now, this process was repeated with multiple steps of decreasing contrast until the subject cannot discern the bars any further. Individual scores are given to all the 5 quadrants out of 20 and total out of 100. Now, we correlated the RNFL quadrants and the clock hours to each of the 5 areas of the SPARCs test. For example, the left upper SPARC zone was correlated with the superior-nasal quadrant in the right eye and the superior-temporal quadrant in the left eye, and the right upper SPARC zone for the superior-temporal in the right and the superior-nasal quadrant in the left. Now, overall, we found that the average OCT RNFL thickness and the global SPARC score showed a significant correlation in both the eyes. There is a scatter plot showing the same. In individual eyes as well, both the average RNFL thinning and the global SPARC score showed a significant correlation. When individual RNFL quadrants and SPARC zones were compared, there was correlation found specifically in the inferior quadrant. The right eye inferior RNFL quadrant correlated well with the right upper and the right lower SPARC scores, and the left eye, it correlated with the left upper and the left lower SPARC score. Similarly, less weaker correlation was also found between the superior and the temporal quadrant. However, we could not find any correlation between the nasal and the central zones. Plot showing the same in individual eyes. Now, a close relationship exists between vision-related quality of life and contrast sensitivity in glaucoma. Patients may complain of a poor vision in spite of very good visual acuity, although contrast sensitivity test is not routinely performed in patients of glaucoma. Now, a significant correlation has also been studied between the reduced contrast sensitivity and visual field loss, but the currently available contrast sensitivity testing tools measure only in the center, which is inadequate in a patient of glaucoma where mostly the peripheral vision is affected. The SPARCs data has shown and found it to be reliable and specific for glaucoma, and has also seen that it has a significant role in staging severe disease, and was also found to be statistically more sensitive and specific than the Pelly-Robson chart test with a better test-retest repeatability. Now, role of contrast sensitivity individually and SPARCs has been and OCT RNFL has been studied in glaucoma well. However, relationship between the both has not been studied widely. In our study, we found that the global RNFL thinning due to glaucomatous damage correlated very well with the decreased contrast sensitivity in the same patient. We also found that the inferior quadrant of the RNFL thinning correlated more strongly with zones of decreased contrast sensitivity in SPARCs in both the eyes, probably due to the susceptibility of the inferior region of the RNFL to early glaucomatous damage. And our findings are in line with the previous study, which was done by Amanullah et al. At a different institute. Now, limitations were small sample size and short duration of the study. However, the biggest limitation was lack of follow-up, which resulted in a lack of consistent trend in findings. So in conclusion, now SPARCs can be a predictive of the RNFL damage in glaucoma, and it can also be a useful tool for the workup and follow-up of moderate to severe glaucoma patients, especially in the post-COVID scenario where most of the patients are reluctant to come to the clinic more often. It is an online test and can be performed at home as well as at the clinic and can be shared with the physician. We also found that the contrast sensitivity testing can be indicate a progressive loss of neural tissue in different areas of the retina. Thank you.
Did you grade the contrast sensitivity like depending upon the severity of glaucoma?
No, ma'am, we could not, because otherwise separately it just gives a score out of 100. So I just wanted to correlate between the thickness and severity separately. I could not in this.
So,
test.
but in OCT, when there is advanced glaucomatous damage, definitely there is a floor effect. So how
Yes,
do you
ma'am.
justify that?
Ma'am, those were the patients that we took who were very well controlled, and we kind of excluded the patients who had some sort of severely advanced glaucomas. We took only moderate to early severe glaucoma. Thank you. Yes, thank you.
Sir, any other questions?
Sir, where do you see the application of this in day-to-day practice?
Sir, I would probably see in patients who are probably not coming to the clinic very frequently or lack of follow-up is there. So suppose a patient we would like to follow up maybe say 6 monthly or yearly, but however the patient due to debilitated nature or maybe the age of the patient, they are not following up. In case if they do this test at home, probably if the results, if we correlate and we find that the results are probably decreasing or showing a gradual decreasing trend, we can call them back to the clinic and maybe intervene with medications.
To include the early glaucoma as well.
Yes, sir.
Right from this study.
Yes, sir. But however, the previous study with this showed that it did not have much significance in early glaucomas. Other studies have seen that it doesn't find.
Age include 8 year of age as well. The cataract status of the patient.
Yeah, so mostly in my study I took only early cataract, and obviously higher severe more the cataract, it can be a confounding factor because of the effect, as well as I think the IOL status as well.
The percentage of patients in 8 year and that.
In my patients, sir, most of the patients were pseudophakic with monofocal IOLs, and hardly a very few patients were NS1. Very early cataract.
You had any visual acuity criteria?
No, ma'am, no severe, nothing, no visual acuity criteria per se, just glaucoma patients with moderate to severe glaucoma.
Like because if the
Yes.
visual acuity,
Yes,
even
ma'am.
in 6/6 in advanced glaucoma,
Yes,
the
ma'am.
contrast sensitivity will reduce,
yes,
but
ma'am.
not in mild to moderate.
Yes, ma'am.
So,
No, we did not.
as such,
take
the
it.
other confounding
Confounding
factors like
factors.
cataract and other
Yes,
things.
ma'am.
So you had excluded everything.
We had excluded.
Any questions, Ajay or others? You also have right to seek clarification from your colleagues. Okay, follow me, tell me. This is a cross-section study.
Yes, sir.
It's a cross-section study, that's what I understand. Why do you state as a limitation short duration of this study? Only if it's longitudinal we are concerned about
Yes, sir.
the duration of this. It's cross-section.
Yes, sir.
So I don't think.
Actually, my major limitation was the follow-up of the same patients again, probably. I think the duration should not be a. Yes, sir. Yes, sir.
Sample size is.
Yes, sir. Thank you, sir.